Urgent calls for transparency in Virginia's healthcare system amidst funding shifts. As federal funding changes loom, the stability of Virginia's healthcare accessibility hangs in the balance, compelling state lawmakers to demand transparency from local hospitals. U.S. Senator Mark Warner and Virginia House of Delegates Speaker Don Scott raised significant alarms during an event in Franklin, Virginia, urging hospital systems to openly address the implications of potential closures, reductions in staff, and widening gaps in health coverage that could arise from the newly passed federal reconciliation bill. Warner expressed his frustration, stating that some hospital chains in Virginia seem to be avoiding public discussion about their challenges. They're trying to bury their heads in the sand, he remarked, suggesting that while these health systems request assistance privately, they refuse to engage transparently with their communities. This sentiment was echoed by Scott, who speculated that hospital executives might feel intimidated by the current political climate, particularly referencing the federal drive under former President Donald Trump to trim government expenditures, which has resulted in substantial job losses across various sectors, including healthcare. Scott pointedly noted that the true essence of maintaining our nation's greatness lies in our willingness to confront and communicate the hard truths to each other, rather than retreating into silence. During the event, which was attended by local healthcare professionals and officials, Warner particularly highlighted Bon Secours, the operator of Southampton Memorial Hospital, one among 6 hospitals identified at heightened risk of service cutbacks or potential closure when the impacts of the reconciliation bill materialize. In response to inquiries from the Mercury regarding this situation earlier in the summer, a representative from Bon Secours directed the inquiries to the Virginia Hospital and Healthcare Association, VHHA, an organization that often advocates for healthcare systems statewide. Indeed, just a month prior, the VHHA collaborated with a coalition of counterparts from 13 states to urge Congress to halt proposed cuts to Medicaid and hospital funding in a letter addressing the reconciliation bill. While Bon Secours has remained silent publicly regarding the upcoming changes, another health system, Ballad Health, has been vocal about its concerns. Cindy Elkins, the administrator of Lee County Community Hospital, expressed her apprehension about the implications of the new legislation. This hospital, historically closed but reopened under Ballad Health's management in 2021, has gradually added services to meet the needs of the rural communities it serves. Despite its vulnerability to losses associated with Medicaid patients, the hospital enjoys special financial protections as a critical access hospital, which may mitigate some impacts of the reconciliation bill. However, the chief operating officer of Ballad Health, Eric Deaton, expressed that the anticipated changes could result in a loss of around $25 million in the first year of implementation, revealing the financial strain hospitals in rural areas are likely to face. He highlighted that operating in less profitable regions is often a calling for many healthcare professionals, emphasizing their commitment to serving these vulnerable communities. The far-reaching effects of the reconciliation bill remain complex and multifaceted. Virginia's Medicaid program serves approximately 1.9 million individuals, with about 600,000 potential beneficiaries who gained eligibility during the 2018 expansion, now at risk of losing their coverage. The situation is compounded by the uncertainty surrounding the renewal of special tax credits that assist residents in purchasing insurance through the Affordable Care Act ACA marketplace. Currently, around 400,000 Virginians depend on these credits, which are available to those earning between 100% and 400% of the federal poverty level. When individuals forego regular medical checkups, they tend to seek help only during emergencies, leading to escalating healthcare costs that hospitals must absorb, causing financial strains that may ultimately result in increased charges for all patients, regardless of their income. Warner succinctly stated, "They're going to drive up all of our rates," emphasizing that the forthcoming changes could elevate healthcare expenses across the board. On the panel were local medical practitioners and advocates who discussed strategies for informing Virginians about the upcoming changes resulting from the federal legislation. Both Warner and Scott underlined the importance of local governments in this educational effort, with Franklin Mayor Paul Kaplan affirming their role. Local public school employee Mona Murphy highlighted the significant impact of hospital decisions on community employment, stressing that residents should comprehend the ramifications of potential downsizing or closure. One audience member proposed a novel idea that hospitals intending to shut down could fund the establishment of urgent care centers to ensure continued community access to healthcare. Scott responded favorably, suggesting that hospitals closing their doors could convert into urgent care facilities to serve ongoing community needs. In light of these challenges, Scott mentioned that Virginia should consider utilizing its budget surplus, albeit acknowledging that this would only serve as a temporary fix. The reconciliation bill also prompted the introduction of the Rural Health Transformation Program, an initiative that Walker of the VHHA described as intended to cushion the effect of the bill on both patients and providers. Furthermore, he highlighted ongoing outreach efforts to engage with both state and federal officials regarding the implementation of this program. Critics, including Scott and Warner, have taken Congress to task for postponing the onset of healthcare changes in the reconciliation bill until after the impending midterm elections, pointing to the urgency of addressing these issues now. Warner is optimistic that bipartisan support may enable legislators to reconsider some of the contentious changes before their implementation. And he is particularly keen on urging his colleagues to renew the ACA tax credits to prevent coverage losses for a significant number of Virginians. I do think a lot of my Republican friends realize that the big bill went too far, he concluded, suggesting a possible pathway toward consensus amidst the challenges ahead.